Hi, good morning. Dr. Charles Fino here from Fino Family Chiropractic. And today I figured I'd go over another question that I get quite commonly, and that is, once you go to the chiropractor, does one, your body always become reliant on receiving the adjustments, and two, will I have to go the rest of my life? And this is something that people that aren't necessarily knowledgeable about chiropractic, or they don't know much about chiropractic in general, commonly ask. And there's a few different ways to think about the answer for this. The first thing I want to address is, do you have to go for the rest of your life? And the answer is, honestly, it's up to you. I would never push someone to go for the rest of their life or to keep coming to appointments that they don't feel like are benefiting them. But to be honest, we maintain lots of things in our life in general. So if we think about our houses, our cars, we go for oil changes, we get the fluids filled, we get our tires rotated. That's maintenance. And if we think about our houses, I just had my furnace cleaned. We maintain, the grass and the shrubbery and things like that. But how often do we maintain all the aspects of our body? And that's where the chiropractic comes in. If we think about other aspects of our bodies, we have our teeth, we have our blood work that we get done through our primary care physicians. These are all things that are done on a regular basis. And chiropractic should be the same way. We should have our spine evaluated to make sure that it isn't deteriorating, and we should maintain it. The other question that goes along with, do you have to go forever, so to speak, is does your body become reliant on it? And I guess the best way to answer that is, do you become reliant on feeling good? Because the chiropractic adjustment is something that feels absolutely wonderful, and if you get used to that feeling of feeling good, I guess so, then yes, but there is no true addiction physically, chemically, mentally to the adjustment. But people, do get used to feeling well after being adjusted, and they want to continue typically. But with my treatment plans that I come up with for patients, they're specific to that patient. So, we test the waters once they're coming off of their active treatment plan to see what's a good interval for them. Some people, it may be as often as every 2 to 3 weeks, whereas others, it might be every 4 to 6 weeks. It really depends on the person and what types of issues and what types of jobs and things around the house that they do that would be a detriment to their spine. So we would kind of figure that out as we go. But it is something that I do recommend. But again, I said it's up to the patient, and I would never force someone to come in. Some people come in for, more so of pain relief, where if something's bothering them, then they come in, which is fine too. But if we're looking at the best case scenario for your spine, it's maintaining it long term. And if we maintain our spine long term, we're going to have less problems. And if problems do arise, they're going to take much less time to fix, so to speak, or correct those issues at hand. So if you have any questions at all about what we talked about here, you can always call the office at 708-926-2854. And I'm more than happy to field any questions you may have. Have a wonderful day and have a happy holiday season.